when we first spoke to consultants about the possibility of twin-to-twin, transfusion syndrome, or, and everything that sort of brought, we were fed all that information, but you don't fully digest it.
No.
And I guess it would have been similar with the neonatal intensive care unit. Someone, and we did actually meet Dr. Werner.
Yes, our consultant actually came to see us when we were in the ward before our boys were born, just to try and manage our expectations or give us some insight into what to expect. And again, I think we were both very naive at that point as to what questions to ask. Suppose when everybody thinks about a premature baby, they think of these tiny little bundles, in an incubator. And that's, yes, while they're in an incubator, there's a lot more to that situation than meets the eye. So yeah, neonatal unit was very much a unit tucked away at the end of a very long corridor that we had no knowledge of or previous experience of until we were thrown into that situation.
And it became our home, so...
I remember being pushed up on my hospital bed from delivery suite, actually. The boys had just been born and it was a couple of hours after, and I had a very lovely midwife who decided that it was important that I went up, so I was pushed up on my hospital bed and into the neonatal intensive care unit, and both our boys were tucked away at the very back corner in 2 separate incubators, and that was the first time that I had seen them, obviously. And there was a lot of tubes, a lot of wires.
A lot of beeping.
Yeah, we still hear the alarms in our sleep at times. Just kind of became so ingrained on our brain.
Yeah.
But yeah, very intense and overwhelming experience.
Yeah, when you're first there, I think it's just the initial shock, and as Nicole said, just the beeps, and then you become accustomed to it.
Yeah.
You just, because you have to. There's no other way around it. But certainly, it's just overwhelming. It's at the time, you just, it was just a scary place for me, and, the fact of not being able to do anything physically, I found very difficult. But like I say, it slowly became home and became normal.
Became normal.
Yes.